So what our project is aiming to do is to develop triage tools for serious adverse outcomes in an emergency care setting for patients with suspected COVID. So the background to this project is that in the UK during the first wave, we collected data from over 20,000 patients who attended emergency departments across the UK. And we've developed something called the pre-score, which can be used to predict death or requirement for organ support. And that's being used to help determine whether, when a patient comes to the emergency department, they then need inpatient admission. And that's been adopted by things like the American College of Emergency Physicians because it's been sort of derived and validated. However, that's only really applicable to high income settings, as it's derived in the UK. So what we're trying to do is derive similar tools which can be used to predict serious adverse outcomes in middle and lower income settings. And in order to do that, we are collaborating with the University of Cape Town, so with Professor Lee Wallace's team. And what they've got is routine data from the Western Cape. And also they've worked with a doctor called Dr. Yassine Neymar in Sudan. And they also have a data set from 2 institutions in Sudan. So we're going to use the 3 data sets, the UK data set, the South African and Sudanese data set, to derive and validate tools which are applicable to a sort of middle income setting, which would be sort of South Africa, the Western Cape, and a lower resource setting, which is Sudan. So we have 3 data sets. The first is the 20,000 patients from across the UK who attended emergency departments in the first wave. The second data is routine electronically captured data from the Western Cape of South Africa, which again will sort of be in the tens of thousands. And then the final data has been extracted from healthcare records into 2 centres in Sudan. So the main challenges so far have been sort of negotiating the different information governance landscapes in the countries which we're working in and with our collaborators. Also, curating and linking the routine data in South Africa is quite challenging because it's the first time that they've used these kind of electronic routine data sets for a project like this. But what's been really good is the secure workbench as a place where we can share the data in a way that we can sort of help deal with the information governance issues, and also the support we're getting from my coder in terms of helping us with the data linkage and curation. So I think developing contextually appropriate and accurate prediction tools for serious adverse outcomes for patients with suspected COVID-19 in low and middle income countries will allow sort of transparent and evidence-based triage of need for inpatient admission and also sort of emergency healthcare resource use more generally in parts of the world where the vaccine rollout, unfortunately, is sort of lagging behind sort of higher income settings. We're hoping that our first tool will sort of be developed using the UK data sets and validated in the Sudan data set around February or March, when we'll be able to hopefully sort of, at least as a preprint, share our first findings for that. The analysis for the Western Cape will be a bit later, and then finally we'll hope to have everything sort of wrapped up by August, September time. So I think the first is sort of pooling and linking the large amounts of existing routine data sets across the world and making them available to researchers in a way that complies with ethical and information governance requirements, but is also, proportionate to what researchers are trying to do, and also making the data available in a way which researchers can actually use, because a lot of this data is very Byzantine in how it's set up. And then sort of the second thing is building the methodological and technical capacity to use these data sets to answer important questions, especially in low and middle income countries, because there are very specific things about routine data sets and how they're set up, and they're different to data sets which have been collected specifically for the purposes of research. I mean, the short answer is no. And the main thing is that because we at the University of Sheffield have a lot of expertise now because of the work we've done in deriving the original pre-score in terms of how to use these data and develop the tools, while the data that actually needs to be analysed is from sort of lower and middle income countries. So data sharing is facilitating us sharing our skills with our collaborators and helping with that analysis. So I guess the driver project is really exciting for us because it's been a way in which we can support a collaboration with the University of Cape Town. And there's a lot of expertise which has been made available to support that collaboration, which would have been able to happen otherwise, and also kind of facilitate the project more generally.